So as you know, SpineCAMP is the first AI platform to look at x-rays and particularly the dynamic nature of those x-rays. When we see patients in the clinic, it's important to understand if the spine is moving normally or abnormally, or when it's not supposed to move, should it be moving, and vice versa. The interesting thing about SpineCAMP and what makes it a very valuable tool is in our workflow in a typical office setting, we have to pull up images and then manually pick points and measure those points. And that's very difficult to do and to be consistent with. And we get variable results. What the SpineCAMP AI does, that's doing millions and millions of things per second to identify very specific points in a reliable fashion, and then takes those points and measures them in a very accurate fashion. So the final product is instantaneous to the surgeon and gives us very accurate data that we can use to make decisions. When we do prior authorization and a peer-to-peer standpoint from trying to see if the insurance company is going to allow us to do a procedure, what better than a completely independent AI that has no skin in the game to basically tell them the data of how much slip is there, how much instability. And we can use that report to say, here, don't believe me, believe this complicated computer algorithm that's very accurate. If I were talking to one of my colleagues, I would really want them to take a look at it, because it's one thing to describe a technology, it's another thing to put it in your hands and use it. And SpineCAMP is one of those things that, yes, it gives you those static reports, but I think one of the greatest values is the stabilized imaging. Once you see the stabilized imaging at different levels, you start to see how the spine moves. And it's interesting because it forms a dynamic motion type of view in your head that you can't get by just looking at static images. And like anything else, it's not something you can describe. You know, say a picture is worth 1,000 words. Well, the motion from stabilized imaging is worth more than 1,000 words.